Hello everyone, and welcome to this mini training about Introduction to Lymphology. First, we will do a quick introduction to the anatomy of the lymphatic system. The lymphatic system is one of the organs that is present in the human body and consists of lymph vessels, lymph nodes, and another number of organs like spleen, thymus, tonsils, lymphocytes, and Peyer's patches. Here on the right in the picture, we can see a small anatomy of the lymphatic system with the lymph vessels and the lymph nodes. Functions of the lymphatic system. Returns protein and water from the interstitium to the cardiovascular system. Absorbs protein, fat, and fat-soluble vitamins through the intestinal lymph vessels. And recognizes and responds to foreign cells like bacteria, microbes, and cancer cells, since the lymphatic system has immunological functions. There are around 600 to 700 lymph nodes in the human body. The majority of them are found in the abdomen, but the head, the neck regions, and also contain the large quantity. Other lymph node stations are found in the axilla or inguinal areas. Lymph nodes are generally located in adipose tissue and are not palpable. Enlarged or easily palpable nodes are always suspicious. Infections in the drainage areas of the nodes will cause enlargement and also cancer disease. Edema, lymphedema, and differential diagnosis of the edemas. What is edema? What is a lymphedema? Edema is when increased lymphatic loads exceeds the transport capacity of a healthy lymphatic system. Edema can be generalized, concerning the whole body, or local, presenting in only one part of the body. For example, congestive heart failure or chronic venous insufficiency. And lymphedema happens when the lymphatic system is unable to remove the necessary lymphatic load from the interstitium due to organic or functional cause. For example, thrombosis and sclerosis of the lymph vessels, obstruction of the lymphatic vessels by tumor, surgery, or radiation. So to make it more clear, when we have edema, there is an increase of fluid in the body. And when we have lymphedema, the amount of the fluid is the same, but the channels cannot drain properly that fluid. That's why we get the edema or the swelling. Differential diagnosis, we will see now some different cases of edemas. The first one, it's related to chronic venous insufficiency. In this case, we will feel pitting pronounced after prolonged standing or sitting. It most commonly involves the lower legs, ankle malleolar area, and less often the foot. The skin may show discoloration, and in more or advanced stages, we can see skin color changes, thickening of the skin, and tenderness. And we see that in the picture, it's bilateral, so it will affect almost in right or left lower extremity. Deep vein thrombosis, acute change in swelling accompanied by pain in the affected extremity, is indicative of DVT. If we say in the picture, only one limb is swollen, the other one remains normal. In that case, manual lymphatic drainage is a contraindication. However, the compression is in many cases indicated. Congestive heart failure. The swelling is greatest in the distal lower extremities. The swelling tends to be bilateral and symmetric. Usually there is deep, soft pitting edema. This swelling often decreases substantially with leg elevation. Liver disorders. These disorders can cause diffuse swelling. These individuals can become extremely edematous, especially in advanced liver disease. Sometimes patients can develop anasarca, which means extreme generalized edema from the chest to the toes. As well, we have kidney disorders, They are somewhat similar to liver disorders. If the person is in hemodialysis, they are not too edematous because the excess fluid is removed in each session. However, if they have advanced renal insufficiency, but they are not receiving any hemodialysis, they can become very edematous as a retention of sodium and water. This patient can respond to manual lymphatic drainage, but needs clearance from the doctor first. Patients with AV fistula from hemodialysis as well may develop chronic lymphedema in that extremity. Complex regional pain syndrome, a syndrome with excessive pain, change in the skin and blood flow, abnormal sweat gland activity, redness, and associated edema. For these cases, manual lymphatic drainage or bandaging is not contraindicated, but it might be poorly tolerated due to pain. So manual lymphatic drainage will be done in the proximal non-affected areas. Postural edema. Stroke, SCI, TBI, and other types of weakness or paralysis result in chronic dependency and immobility of the limbs that cause increased capillary pressure, which leads to chronic edema. Compression therapy, manual lymphatic drainage, and passive pumping exercise are advices for these cases. Medications. Many medications can cause swelling, and this edema will be typically bilateral. Medicines for high blood pressure are one of the most common that cause edema, as well as medications for diabetes. Insulin can cause some degree of sodium retention, resulting in swelling. Many diabetic patients are obese already, having edema or lymphedema, so this medication may worsen the symptoms. How to treat edemas? The main way to treat the edemas is through complete decongestive therapy, which has 4 components. The first one will be manual lymphatic drainage. It's a light skin stretching massage that helps to promote the movement of lymphatic fluid out of the swelling area. Should not be deep, not painful, and never use oil. Second component, compression therapy. It reduces the filtration of water into the tissues, improve muscle and joint pumps, and prevent the reaccumulation of evacuated edema fluid. Compression therapy without manual lymphatic drainage can lead to proximal edema and fibrosis to the closest tissue. Third component, exercise. Performing exercise while wearing compression helps muscle and joint pump and facilitate lymphatic and venous return. Exercise routine should be customized for each patient. And the last component is skincare. Meticulous skincare and nail care is important to prevent fungal infections and cellulitis. Contraindications for the complete decongestive therapy. Absolute contraindications, acute infections, especially cellulitis, and in these cases we can resume the therapy after 5 days of completing the antibiotic course. Another contraindication, untreated congestive heart failure, and the last one, acute DVT. In that case, compression, as I mentioned before, is indicated, and the manual lymphatic drainage should wait 12 weeks for proximal DVT and 6 months for distal DVT. And relative contraindications, malignant disease, means active cancer or untreated cancer, or renal dysfunction. Edema assessment. How are the ways to assess the edema? First one is the pitting scale. To check the pitting, we will put our finger into the swollen area and we will press 15 to 30 seconds. If when we remove the finger, there is 2 millimeters depression and immediate rebound, we will say there is pitting 1+. If there is 4 millimeters deep pit and it takes few seconds to rebound or to come back to normal, we will say it's pitting 2+. If we will have 6 millimeters deep pit and it will take 10 to 12 seconds to rebound, we will call it 3+. And if we have very deep pit, 8 millimeters, and it takes more than 20 seconds to rebound, we will have a pitting 4+. Here you can see different pictures of pitting edema. In the first picture, the therapist is pressing in the swollen area, already pressing one limb, and you can see the deep pit. All of these pictures are pitting plus 4. Another way to assess the edema is by the severity. We have 3 levels: mild level, moderate, and severe. Mild level means the limb is 1 to 3 centimeters bigger than the unaffected limb. Moderate, 3 to 5 centimeters bigger than the unaffected limb, and severe, more than 5 centimeters bigger than the unaffected limb. The manual lymphatic drainage techniques there are some basic strokes. It's called 3 of them: stationary circles, apply in all areas of the body; pump techniques, mainly in extremities or rounded areas of the body; and scoop technique, only on the extremities. In this picture, there is a big longer explanation about the basic strokes of MLD. However, if I cannot show you, it's very difficult to understand. So if someone wants to know more about how are the manual lymphatic drainage strokes and wants some live demonstration, please feel free to contact me anytime. We can use kinesio tape for reduce the edema, and it works very well. When kinesiology tape is applied to a swollen area, the lifting motion of the tape creates a space between the top layer of the skin and the underlying tissues. This space creates a pressure gradient between this area and the surrounding tissues that allow fluids to move into the lymphatic vessels and be eliminated from the body. Enhanced muscle activation increases the muscle pump, pushing more fluid through the lymphatic vessels. The swelling goes down, pain is relieved, and the healing process is accelerated. Here we can see one picture about how the kinesiology works in the swollen area. But again, if you would like to see one demonstration about how I apply the kinesiology for the hand or for the feet to reduce the edema, contact me and we can make one live demonstration one day. Thank you so much and hope you enjoyed.